Okay, so today in medicine, we are going to look at rheumatic heart disease. So this is another cardiovascular system condition. So we can define rheumatic heart disease as this is a cardiovascular system condition resulting in permanent damage to the heart valves caused by group A beta hemolytic streptococcus, characterized by fatigue, fever, as well as the generalized body weakness. So when it comes to rheumatic heart disease, when the group A beta hemolytic streptococcus enters the body, you find that this individual is going to have a generalized body weakness because there is damage to the heart valves, which is allowing backflow of blood back into the ventricle. Hence, you see generalized body weakness. Apart from that, you are going to find that there is going to be presence of fever due to presence of the group A beta hemolytic streptococcus in the blood. You also see fatigue. The person will be getting tired easily because of reduced oxygen, reduced tissue perfusion. So you're going to see these symptoms manifesting in rheumatic heart disease. But one thing you need to understand is that rheumatic heart disease is a condition which arises from rheumatic fever. Rheumatic fever itself, it is an upper respiratory tract condition which affects the upper airway. But you find that because the group A beta hemolytic streptococcus gains access to the blood vessels, you find that this microorganism will find itself to the heart muscle tissue and attaches itself on the proteins found on the valves, resulting in severe inflammation which causes fibrotic formation on these valves. So you find that the point when this microorganism reaches the muscles of the heart, or the valves of the heart rather, the condition will no longer be called as rheumatic fever, but it will be known as rheumatic heart disease. So we can look at the pathophysiology or the disease progression of rheumatic heart disease. So you find that once the causative organism gains access to the upper airway, it will attach itself to the epithelial cells of the upper airway, resulting in inflammation. So once inflammation occurs, this is going to create a port of entry for the group A beta hemolytic streptococcus entering the blood circulation. Once the beta hemolytic streptococcus enters circulation, the body's immune system is going to begin to produce antibodies against the organism. And these will circulate in the blood and begin to fight body structures which are harboring the group A beta hemolytic streptococcus, such as the heart muscles or the joints of the body. This will now result in severe inflammation of the heart valves due to body's immune response because of presence of the microorganism, which will now further heal, leading to fibrotic formation of the heart valves, which causes now incomplete closure of the valves, allowing backflow of blood. And this will result in manifestations of symptoms such as fatigue due to reduced oxygen supply to the body tissue, chest pain due to myocardial infarction, fever due to presence of the beta hemolytic streptococcus in the body, and other clinical manifestations. So this is how the disease progresses for rheumatic heart disease. So for you to explain the pathophysiology, you need to explain the disease progression and how certain symptoms are manifesting. So these are the things.
Network error and network problem. So we ended on the pathophysiology. We can move on to the signs and symptoms of rheumatic fever or rheumatic heart disease rather. So when it comes to signs and symptoms of rheumatic heart disease, you're going to see symptoms such as fatigue. And we have talked of fatigue in our pathophysiology that this is due to reduced oxygen supply to the body tissue. Shortness of breath, this is due to impaired tissue perfusion. Then chest pain, this is due to carditis or myocardial infarction. Then apart from that, you're going to see other symptoms such as fever due to presence of group A beta hemolytic streptococcus in the blood. Apart from that, you're going to see malaise due to reduced oxygen supply to the body tissue. So these are some of the symptoms that you can see in rheumatic heart disease. From there, we can move on to the management of rheumatic heart disease. For you to manage successfully a patient with rheumatic heart disease, you need to start from medical management. And this is not a long condition, so it is very short but very cardinal for you to know. So when it comes to the management, we are saying we'll start with the medical management, and as usual, you're going to have the first heading, which is aims. So on aims, you are going to say some of the aims you can have is to promote a quick recovery, to promote tissue perfusion. Apart from that, you can say to relieve cardinal symptoms of rheumatic heart disease. You can also say to prevent complications such as cerebrovascular accident. So those are some of the aims that you can have. Apart from that, then you can now move on to the to investigations. You have your next heading, which is medical management. Then the next, under medical management, you have a smaller heading, which is the investigations. And on investigations, as usual, you start with history taking. So you can say the patient will present with history of an upper respiratory tract infection. And then the next point is a physical examination point. So you can say during physical examination, the patient will present with the raised body temperature and the generalized body weakness. Apart from that, you can now move on to either lab or radiological investigations. And here you can say you can get blood for culture sensitivity reactions, which will review presence of the group A beta hemolytic streptococcus in the blood. You can also do a chest X-ray, which will review congestion in the heart. Apart from that, you can do other investigations such as a throat swab for culture sensitivity reaction as well, and it will review the causative organism. And you can also do an electrocardiogram, which is ECG, which will review abnormal electrical heart impulses. And then you have at least five investigations. Then from there, the next heading is the treatment. And on treatment, you need to give at least 3 specific drugs. So on 3 specific drugs, make sure you add on the mode of action and the 2 side effects and at least 1 nursing implication. But the drugs that can be given in rheumatic heart disease, you can give drugs such as Pen-V, phenoxymethylpenicillin. So Pen-V, which is phenoxymethylpenicillin, you can give 500 milligrams QID for 7 days. But even if you wrote it as Pen-V, it is not an abbreviation, you're going to be marked. Apart from that, you can give benzylpenicillin 2 to 4 mega units, QID IV for 7 days, including Pen-V. You are giving it IV rather. Apart from that, you can give an anti-inflammatory drug like prednisolone. So you're going to give 25 milligrams once daily orally for 7 days. So these are the 3 specific drugs that can be given in treatment of rheumatic heart disease. From there now, your heading is going to be nursing management. And under nursing management, for any cardiovascular condition that you're managing, you manage it as an emergency condition, meaning you are starting with maintenance of airway, breathing, as well as circulation, which includes rheumatic heart disease as well. So you are going to, after nursing management heading, you're going to have a smaller heading under nursing management, which is the patient resuscitation. And under patient resuscitation, you are going to have a smaller heading, which is maintenance of, airway, just airway as a heading. So on airway, you can say I'll suction for any presence of secretion so as to promote a patent airway. You can also say I'll reposition the patient in lateral position for free flow of secretions. You can also talk about removing any, loosening clothes which may impair or block the airway. Then apart from that, you can talk about breathing. On breathing, you can say I'll administer 3 to 5 liters of oxygen per minute so as to promote tissue perfusion. So on breathing, you can administer 3 to 5 liters of oxygen per minute so as to promote tissue perfusion. Apart from that, you can say I'll give air using an ambu bag so as to promote lung perfusion. You can also say I'll nest the patient in a well-ventilated environment so as to promote air circulation. Then from there, you even now move on to circulation. So on circulation, you can say so from there on circulation, we are saying you can give fluids such as normal saline as a blood expander, 5 mils per kg body weight per hour. Apart from that, you can give fluids such as dextrose, 10% for energy so as to promote usage of the accessory muscles of the chest. Apart from that, you can give Ringer's lactate if there is electrolyte imbalance so as to replace the lost electrolytes. And you can also just promote oral intake of fluids as this will improve the patient's condition or improve circulation. So these are some of the points that you can give on circulation. From there now you can bring in a prophenema. So you can talk about environment, and from environment talk about position, and on the position you need to nest the patient in semi-polars because this promotes lung expansions. And then apart from position, you can talk about rest, which is cardinal, talk about observations, talk about psychological care to the patient, hygiene, talk about nutrition, talk about exercises, which are cardinal in any cardiac condition, and then also talk about medication, talk about elimination, and then as well as advice on discharge. So points on a prophenema will always be the same. So all you need to do is master the points, because once we say it's a prophenema, the points are just going to be repeated, just like we have been mentioning them in previous conditions. So that is how you can manage rheumatic heart disease. You start from medical management, then you come to nursing management. Some complications that can arise from rheumatic heart disease, we have complications such as CCF, cerebrovascular accident due to reduced oxygen supply to the brain tissue. The patient can also experience symptoms such as joint pain on the joint pain, which may result to joint inflammation rather due to invasion of the group A beta hemolytic streptococcus to the joint muscles. Apart from that, the patient can also experience congestive cardiac failure, which is CCF, and this is due to reduced oxygen supply to the myocardium because of the backflow of blood. So there is impairment in the myocardial circulation, which may result in development of CCF. Apart from that, rheumatic heart disease can result in renal failure due to impaired renal perfusion, reducing glomerular filtration rate. So these are some of the complications that can be seen in rheumatic heart disease. And this is where we end with today's lesson.